America faces a healthcare crisis. Chronic diseases are on the rise. Heart disease, cancer, and diabetes are major concerns. These conditions impact millions of Americans. The costs are staggering, both financially and in terms of human suffering. Adding to this crisis is a declining trust in the healthcare system. Americans are increasingly skeptical of medical institutions. This distrust can have serious consequences for public health. Many factors contribute to this crisis of trust. One key issue is the reactive nature of the current system. The focus is often on treating disease after it occurs rather than preventing it in the first place. This approach can leave patients feeling like their health is not a priority until they become ill. Furthermore, the complexity of the healthcare system, with its confusing insurance networks and medical jargon, can be alienating for many. The decline in trust is not universal across the healthcare system. While trust in institutions like hospitals and insurance companies has eroded, trust in individual healthcare professionals remains relatively high. People generally trust their doctors and nurses. This suggests that the crisis of trust is not necessarily about medical expertise. The impersonal nature of large institutions likely contributes to this disparity. Long wait times, rushed appointments, and a focus on profits over patients can erode trust. Conversely, individual healthcare providers who take the time to listen to their patients, explain their options clearly, and build strong relationships can foster trust even within a flawed system. The idea of integrating different medical practices is not new. Throughout history, cultures have blended traditional healing methods with newer medical advancements. For example, in the early 20th century, Western medicine began incorporating aspects of Eastern practices like acupuncture and yoga. These integrations were often met with resistance from the established medical community. However, as evidence grew to support the benefits of these practices, they gained wider acceptance. This historical context suggests that the integration of homeopathy into the conventional healthcare system, while perhaps radical today, is not without precedent. The pharmaceutical industry plays a significant role in the healthcare system, but its influence has also raised ethical concerns. The aggressive marketing tactics of some companies, coupled with a lack of transparency about potential side effects, have eroded public trust. The high cost of prescription drugs is another major concern. Many Americans struggle to afford the medications they need, leading to difficult choices between their health and their finances. This situation raises questions about whether the pharmaceutical industry is prioritizing profits over patients. Addressing these ethical concerns is crucial for restoring trust in the healthcare system. Section 5. A need for change. Voices from the community. To understand the perspectives of those most impacted by the healthcare system, we spoke with individuals who have navigated both conventional and alternative medicine. Their experiences highlight the need for a more patient-centered approach that prioritizes prevention and empowers individuals to take control of their health. One interviewee, a 42-year-old woman named Sarah, shared her frustration with the conventional approach to her chronic migraines. She felt rushed during appointments and dismissed when she asked about alternative treatments. Eventually, she found relief through acupuncture and dietary changes, but lamented the lack of integration between these modalities and her conventional care. Section 6. A binary solution combining homeopathy and conventional medicine. A binary healthcare system integrating homeopathy and conventional medicine offers a potential solution to the current crisis. This approach recognizes the strengths of both systems. Conventional medicine excels in emergency care, surgery, and the treatment of acute illnesses. Homeopathy, on the other hand, focuses on preventative care, addressing the root causes of illness and treating the whole person, mind, body, and spirit. This integrated system would empower patients to choose the approach that best aligns with their values and health needs. It would also encourage collaboration between practitioners from both disciplines, leading to a more comprehensive and holistic approach to healthcare. Section 7. International models. Success stories in healthcare. Other countries have successfully integrated different medical practices into their healthcare systems. Switzerland, for example, has a long tradition of incorporating homeopathy. Many Swiss insurance plans cover homeopathic treatments. Germany is another example, with a dual system that recognizes both conventional doctors and Heilpraktikers, practitioners of traditional European medicine. These models demonstrate that integrating different approaches can expand access to care, improve health outcomes, and potentially reduce overall healthcare costs. Section 8. Restoring trust, transparency, prevention, and ethics. Restoring trust in the healthcare system requires a multifaceted approach. Transparency is paramount. Patients need clear, understandable information about their treatment options, potential risks, and costs. The influence of pharmaceutical companies should be transparent, and conflicts of interest should be addressed. The healthcare system must also shift its focus from treatment to prevention. This includes promoting healthy lifestyles, providing education about nutrition and exercise, and addressing social determinants of health like poverty and access to healthy food. Finally, ethical considerations must be at the forefront of all healthcare decisions. Section 9 Conclusion. A healthier future for all. The healthcare crisis in America is complex but not insurmountable. By addressing the root causes of distrust, embracing a more holistic approach to health, and prioritizing prevention, we can create a healthcare system that truly serves the needs of all Americans. A future where everyone has access to quality, affordable healthcare and feels empowered to take control of their health is within reach.